Hi, everyone. Welcome to AI for Good podcast. I'm your host, Reena. And today we're talking about AI for Good in healthcare. I have the president and CEO of Stanford Healthcare Tri Valley, Misty Jones. Misty, welcome.
Thank you so much, Reena. I'm super excited to be here today.
At the last board meeting, we talked about AI and we talked about the different ways that AI is exploding into scene in every industry. What is it going to do in healthcare? Because healthcare is not an easy industry. A lot of different constituents, components, outcomes. And this is why healthcare has not been an early adopter of technology. So, what does AI for good in healthcare mean for you?
So, when I think about AI applications in healthcare, what excites me the most about it is the impact it's going to have for not only our patients that we care for. So, I do believe it'll help us to get better and more accurate diagnosis earlier in disease state. I think it'll help us start to look proactively at how we can manage people's health state to keep them healthy as opposed to waiting until we need to have a curative solution. I think also when we think about specifically in healthcare, part of the thing that makes healthcare so complicated as an industry, it is highly, highly regulated because we're dealing with people's lives, right? So there's a certain amount of it's got to be evidence based, there's got to be standards, there's regulations, there's laws, there's compliance. So it's a very, very complicated ecosystem within healthcare. So with that, it does one of the barriers for early adoption in AI, but it's also, I think, one of the opportunities for once we get through those barriers for AI to really start to help us. And what I mean by that is some of the challenges that we have in healthcare is because of all of the regulations and the safety, and we want to make sure we're doing the right work. It's really had us kind of turn our focus as our clinicians, so our physicians, our nursing teams, those who are interacting with patients on a daily basis. They've really had to focus on documentation and data acquisition and understanding just reams and reams and reams of paper, if you will, or data about their patients. And, when you think about the limitations of the human being and when they're trying to see, if I'll just use a doctor. So even if they're trying to see 20 patients a day, that gives them 30 minutes to spend with a patient. What's not helpful for anyone in that interaction is for that 30 minutes be the physician just trying to read high level overview of the patient's chart, get an understanding of what the patient needs, and most importantly, how they can be helpful. So one of the things that AI is going to do with that is it's going to help us assimilate all of that information into a way that really helps get the high level and most important information forward to our clinician. So then a physician can go in and say, we've got somebody who's been, in our primary care has been our patient for 15 years. I've seen them 30 times over the course of their life. We've had a couple of hospital stays. That's a lot. I mean, that's probably we're thinking of paper charts, that would probably be 800 to 1,000 pages of information about this one patient. While clearly one physician is never going to be able to get that full picture and understanding. But what AI can do is really kind of assimilate all of that data in a matter of seconds, bring it forward and have a clinically impactful summary for that physician. So that way, as the provider's starting to read through and understand and get to know, or just refresh the information about their patient, that allows them to take their focus off trying to read, understand, and really focus more on the relationship with the patient. And so, where I think AI is really going to start to shine in healthcare is it's going to take a lot of those standard rote menial tasks off of clinicians, that all of the things that we need for making sure that we're delivering best practice to our patients, that we're meeting all of their needs, but it allows us to get that support functionally from AI to generate usable or actionable items for the provider so they can spend more time building that personal relationship with our patients. So I think that's probably going to be the biggest game changer and the thing that I'm most excited about from a patient experience and a clinician experience, really, because there's not a clinician, a doctor, or a nurse anywhere that gets super excited about having to chart for 30 minutes after we've had a 10-minute conversation.
Oh, worrying about doctor burnout, patient and caregiver burnout. This is definitely the right direction, I believe. And in fact, it has been rolled out and it's being tested, I know, because I have physician friends who talk about how, they've got their evenings back
Yep.
because they would typically go home and then sit down and spend another 2 hours or so just charting and writing notes. And I remember one of my physician friends saying, what's fantastic, Rena? the other person, they actually had an accent and they were speaking sort of bilingual, right? They were bringing in words from another language. And I thought, oh God, this one I'm going to have to sit down and re-listen. And she said it was flawless.
Mhm.
The AI that they've implemented for charting, et cetera, it was just flawless. So that's been rolled out, right, at Stanford Healthcare Tri-Valley?
Yes, it has. So we're looking at different like functions. So we're starting to use and pilots, we're looking at Chat GPT just to kind of help us get those summaries. So again, talking about that work-life balance for physicians, spending less time documenting in the evening, but that also gives them their restorative ability, right? So we've got spot on a technology that we can use to help us do the work that we need to do, but that allows us to, if we're not focusing on the patient directly, to your point, that gives us more time to refresh ourselves through meaningful activities for us, spending time with family, going out and doing whatever it is that brings us joy.
Now, on the diagnostic side, I was excited when I saw some demos around a technology where the AI would have read, I don't know, a billion charts for specific types of cancers. And so its ability to read a radiology report would be that much more refined. And so this apparently the tsunami that's coming where radiology would be a department that would get impacted, not necessarily from a cost standpoint, but really from the ability to do a much tighter diagnostic. What are your thoughts in terms of what do you see with respect to on the actual specialties? Which specialties will get impacted? And is that near term? Is that in 6 months? What's kind of the trajectory for that rollout?
Yeah. So I think, you talked about radiology. So that's a really great example. So if you just think about just the visual acuity of a human being staring at a two-dimensional picture, there's a limited ability to be able to kind of read in and diagnose that. Now we've done some amazing things with CT and MRI and like 3D imaging and twisting and turning. We wouldn't be able to do that really without AI. There has to be this thing that kind of brings all of that information together and organizes it in a way that our brain can process it. And so our clinicians can process it. So, what would, from a radiology standpoint, for example, they, again, when they're looking at a picture, they might be looking at one particular component of that I'm just looking for what's causing their chest pain or,
Right.
their breathing difficulties. But with AI, it's looking at the whole thing. So we're talking about like incidental findings. So there might be some very tiny little, it literally might be 2 or 3 pixels wide that the human eye would never even see that. But AI can go in and look at that film or that image and say, oh, this could be a problem and can actually get us to diagnose disease states earlier. So that's great for patients. So when we start to think about just the quality of life impact, earlier diagnosis and treatment of any disease state means better outcomes and better quality of life for patients on the back end of the treatment. From a physician workload standpoint, we're in a physician crisis. And so if you're thinking about radiology in particular, I think AI is very helpful for that because then instead of working, getting a really long work list for just a few humans who are just rushing through because there's so much work on their plate, then they might miss things. The AI is actually enabling us to be able to scale and keep them more efficient and effective in the work that they're doing. So to your point, that they can start to focus on things that maybe it just needs that validation right now of AI technology. So early stages, but I think radiology, pathology, anything that really requires kind of that visual acuity, we're going to see a lot of really, really great enhancements there that I think are going to help us bridge some of the workforce gaps that we have. But I also don't want to leave out even just like general practitioners and, for primary care. So, more and more people are getting more concerned about their health as far as like wearing digital apps and, tracking all of their metrics and kind of bringing that all into their picture and to their personal portfolio of health. And so I think again, when we were talking about earlier about just that physician visit that has all of that information just in the electronic medical record within the health system, now we're looking at somebody potentially bringing in all the data from their apps or, how they're tracking all of those things. So I think what we're going to see is we're going to start to see technology enable processes that allow us to spend more time on creative functions. So I think it's going to be a benefit across all physician services, but primarily we'll start with those that are really more advanced and really more on the visual acuity part, like pathology, radiology, et cetera.
Yeah, dermatology is another one I've heard.
Dermatology,
It'll do
absolutely.
what time frame do you think, though? Where are we in that?
Oh, I think we're pretty advanced as far as like, if we think of AI in the scheme of things, we're pretty advanced in those early few specialties. That
Okay.
being said, I think over the next 2 to 3 years, we're really going to start to see those enhancements. One of the reasons that healthcare, as I talked about earlier, is such a late adopter for everything is because we're a highly regulated industry. We have to have governance and steering because we're dealing with patient lives. And I think as health systems start to develop AI governance committees, that we're starting to understand what are the impacts, but also the limitations, because you can't be like dewy eyed about AI and think, oh, this is going to solve all my problems without really making sure that we've got a model that is really supportive of the work that we need done. There has to be some checks and balances. But overall, I think, we're already well into that. And then we're going to start to see health systems be able to adopt more with comfort, knowing that they've got processes in place that are just reviewing again the ethics, the technology, how the language model learns. Most importantly, how do we make sure that this is evidence? It's driving us to evidence based and optimizing patient care.
Are you involved in any kind of governance councils? I've been looking to see, so exactly as you said, there has to be some kind of a governing body that allows all those in healthcare to stay abreast with what's coming, what are the challenges, what are the issues, who's getting hacked, what are the ethics issues. It's too much for an individual institution to just manage on their own. We do need some kind of a shared governance board or council. Is Stanford actively creating one, participating in one? Any light you can shed on that?
Yeah, so I do believe that Stanford has some, and we have an AI governance committee internally. So when we're looking about that in the technology that we're adopting within the health system, we already have a rigorous process, as many health systems do. But I think what you're looking at is kind of that overarching, almost like I don't want to say big brother government, but that's exactly, kind of what we're thinking about. How do we start to standardize that across all of that? And I think that that's really important work. I think that there's pockets of it. So, but as far as like national bodies, so like the American Medical Association, American Hospital Association, I think everybody understands and they're working on developing things, but I don't know that we have a comprehensive view, or more so because we love to regulate things in healthcare, have any specific regulations around that. So it's kind of it's a mixed bag, really, because I think if we get to that point, I think that's really going to help a lot of these disruptive tech startups. Because I think when you're in a creation mode and you're thinking, oh my gosh, this is going to be the best product ever, you can almost get blinders on to like what is the real true impact, or where are some of the gaps in that technology. And I think that's what's so important in healthcare is that we have that, like, this is the standard vetting, or at least like the minimum basics. And then if healthcare systems choose to add additional requirements above and beyond before they're comfortable implementing it into their system, I think that makes sense. But, it's really kind of right now, kind of everyone's game. And I think that there's idea that we know we have to do it from an ethical standpoint, patient safety, all of that. I just don't know that we've gotten to the point that we're getting that conversation on a national or global level.
And that's actually WAIFO, right? World AI Forum. The whole purpose and mission of what we're doing here
Mhm.
is to help organizations rise up and say, you know what, we need to create a standards committee across borders, across, because, healthcare hospital in Tri Valley versus Palo Alto versus Utah versus New York, versus Kaiser versus private. It shouldn't matter. When AI is rolled out, there has to be a way that we can say, here's the standards that we've all agreed to. And oh, by the way, these standards change every couple of months because AI changes every couple of months. And here's, especially as we look at exposure from hacking standpoint, from
Yes.
just miscreants, people that come in and do AI for bad. Like I'm labeling it AI for bad. There's an AI for good and there's an AI for bad. And we have to be able to all come to an agreement in terms of what does AI for bad look like.
Mhm.
There's a 16-year-old boy who just committed suicide, and the parents are suing OpenAI because they believe that the conversations that this boy, this little child had really led him to make that decision. And so, really, anyone that's using AI for therapy has to stop, go back into the back office, sit down with everybody and say, what is it that we need to do today so that
Right.
our app does not create that? And I think that'll probably trickle into every aspect of healthcare, right? Not just dealing with those who are depressed or suicidal. But that's a question that I think we need to ask at every level. How do we control the conversations that AI is allowed to have that will not harm humans?
Exactly
Um,
right.
Jumping to more on the positive side, there's this dream that I have as I've been sick twice. I've had two big health crises. I've almost died twice. And so I've been intimately connected with the healthcare system as a patient. And so my dream always is, I spent 3 months trying to figure out a diagnosis. They couldn't figure it out. So I was one of those, idiopathic something, something. We don't know what's wrong with you. 20 symptoms,
Mhm.
you're dying. We really just don't know what's wrong with you. So kind of go home and figure it out, or we can put you on steroids and antidepressants. And so having gone through those cycles, I always feel like maybe there's like a robot case where you walk into it and it can see the symptoms and it can, again, looking at whatever trillion bytes of data that it's had across everyone who's had similar, it can say, you know what, these are the potential causes and this is what kind of we need to do. But that becomes step one, even before I meet a physical physician. Do you think that'll ever happen where the first line is really some kind of a holistic AI powered read of someone, and that's when it gets handed off for physician care?
I do think so. So, I mean, if I'm going to get super crazy, I always have this idea of, like a healthcare metaverse, right? So my little avatars walking around the digital and, within that is like essentially all of my healthcare data. So it's not only my portable EHR that's associated in the avatar, but it's also populated with my wearable devices and things that are happening. Because when you're talking about diagnoses and, I can't necessarily speak to your condition, but there's so many symptoms that are either one vague or could apply to 50 different disease states. So then if we go back to the limitations of human knowledge, understanding, and me as the one person trying to process that as the physician, as an example, that is a lot of information to digest. So that's how we miss things. That's how people get misdiagnosed. That's how, it takes us a longer time to get to a diagnosis is because there might be information that either the patient forgot to share, didn't think was important or relevant, or some remote family history, things like that. So all of that could potentially, and again, leveraging that large language model to pull all of that information together. I absolutely think that it could. And then if you have the ability to get that information and you're talking about a robot scanner, even if it's just I jump onto some sort of a platform and, it just kind of gets all that information and can start to look at that. I think what it can do is it can really start to narrow us down to different options, a few options. So instead of having be this boilerplate that, well, we don't really know. So let's start with, steroids or something like that. That's very broad or broad spectrum antibiotics and things like that. Now we can really start to narrow our focus and tailor that. So I do think that there will be a point. I mean, just look at how far we've come, like even in the mortgage industry or banking, things like that. You can literally do everything online where it used to take months and lots of paperwork and all of the things. And you had to kind of pull all this disparate information. Now, because of AI and some things that they've built on in the background, literally can get a preliminary yes or no within a matter of minutes online. And I do think that we will get there. It's just again, because we're dealing with human lives, there has to be that extra level of are we doing the right thing morally? Is this, correct? Are we making sure that we're not taking our patients, as that unfortunate situation with the chat GPT and the teenager, making sure we're not driving people down a very wrong clinical decision pathway or connectivity. And we don't want to chase people to be in circles.
Absolutely.
Yep.
And, as I look at the healthcare arena in terms of the different people that are participating in this entire patient care flow, one of the positions that my heart always goes out to is that of the nurses. It's a tough, tough job. They work long hours. It's a very hard job. And do you ever see the appearance of maybe a robotic nurses? We're seeing this a huge explosion of highly sophisticated robots that are doing highly sophisticated things, and I don't even want to talk about in the physician side, but really on the nursing side. Because then you don't have the challenge where there's a patient screaming at a nurse and she's a human, she's taking this all
Mhm.
inside. From a robot standpoint, it's a lot easier to have a nurse robot. What are your thoughts on that?
So I think, again, it kind of goes back to what I talked about earlier. Part of the profession of nursing, and, this is Gene Watson has done a lot of work in nursing theory, and it's really about the theory of caring and how nurses show up and how we interact with our patients and make sure that we're advocates for them and those things. So while I do think that, it's probably more of a societal curve and comfort because when you think about somebody, I'll just use, my former practice background is the emergency department. So when you literally have a human coming in that's broken from a car accident or whatever, they just want somebody who can, one, offer them comfort, hold their hand. And some of that takes trust and relationship. So do I think that people are ready to accept maybe a bedside and a robot nurse right now? I'm not sure. But I do think that there's a lot of functions that, right now, because the nursing shortage is pretty profound, how can we start to leverage robotic or even AI technology, smart technology in a room to be able to keep patients safe and then kind of prioritize the nurses' workflows so
Exactly.
that, we've got a smart room that's monitoring ambient temperature, the position on the bed. So if we get a confused elderly patient, we don't have to, have them restrained in the bed, or we don't have to have somebody sitting there just watching them sleep because they're at risk of falling when they stand up. Now we have smart technology that says the patient turned or they're getting out of bed or there's some predictive things there that we can then respond to. In the meantime, the room lighting could change and there could be a voice that says, please stay in the bed, help is on the way. So I think there's some enablers like that that will help us get there. Do I think that we're ready to give up that human connection? I'm not sure that we're there yet.
Yeah, absolutely. I think it's gonna be a different generation that accepts that.
Absolutely.
And that
Absolutely.
and it'll be interesting to see at what point that tips, because they're talking about robots that are gonna be drivers, and so it's back to that, at what point does that comfort level happen? But I couldn't agree more that, the biggest part of a nurse's contribution is that compassion, that human touch.
Yeah.
So, for sure. So, as you know, I'm a tech entrepreneur, that's my DNA. And as I look at, if I was 25 and doing a startup in AI and healthcare, what guidance do you have for them? What do they need? What areas could they create something in AI that could be transformational in healthcare versus incremental? Because I feel a lot of startups are still doing things that are sort of incremental. They're not leapfrogging, they're not taking the bigger thought process steps because, again, healthcare is considered to be a much more conservative arena. But if you were to give guidance to a room full of, I don't know, tech entrepreneurs looking to do something in healthcare, what could they do that would transform your life, the life of everyone working in at Stanford?
Gosh, I mean, if this was my one wish list and the guides that I would want to give them, because I think you're right. And it's the same thing with like any kind of medical device. We get very focused on this one tiny pain point and we want to find a solution for that. And what we're doing is we're kind of missing the whole bus. So, I mean, if I'm thinking like if I were really thinking about, I want the best and the biggest bang for my buck or be able to implement something that's, maybe it's not super sexy or it doesn't fix a particular initial, well, or not initial, but like a particular problem, but it really overall contributes at scale improvement. I would focus technology on how to help people stay healthy, and stay out of the hospital. If we can reduce the impacts, if you talk about social determinants of health, what we do in healthcare, as complicated as it is about 20% of what is somebody's overall health. So how can we start to, think differently about, food and nutrition and leveraging AI in that or healthy behaviors or walking and, some of that is behavioral, but how can we start to change the way people behave so we can avoid them getting sick in the first place? And is there a space and a place for AI to really start to help us do that? Some of it's, community planning, but smart communities. I think that's probably where I would focus. Ultimately, I would love to be out of business because people aren't getting sick because they're out living their best life.
Absolutely, absolutely. It's very traumatic to be in a hospital setting, knowing that you're sick and everyone around you as well. I mean, my daughter is doing first year of residency and, as she describes it, it's sort of a sad place to be.
It is.
So you're right. What's interesting is that your advice overlaps with Dr. Sanjeev Chopra, who's Dr. Deepak Chopra's brother, who I just interviewed. He's at
Mhm.
Harvard. And, he said, here's how I see AI like at night. It reminds me, hey, three things you were grateful for today. It's all
Yeah.
stuff that we're meant to do, but we don't because we forget, because we don't prioritize it, because it's not a habit yet. That one of the biggest impacts that could happen is that there's some kind of a robotic interference where it's guiding me into a better,
Mhm.
healthier life than the way I'm living today. So thank you for sharing that. But what does an AI powered hospital of the future look like? I feel like what Netflix did to Blockbuster
Mhm.
is going to happen, that there's going to be a massive disruption in the flow of patient care and just how we work today, right? I get sick, I call my doctor, I go in. She says, "Oh, let's do some tests because this looks serious." Then I get sent to specialists, then they diagnose me, then they put me on a care, and then maybe I get tracked, maybe I don't. But that model, I feel like, is ripe for disruption because there's some inefficiencies in it. So, what does Misty Jones' AI-powered hospital of the future look like?
So, I think if we're thinking about the AI and the hospital of the future, I love one of the things that I love so much about Disney World is because it's really focused on that visitor experience, right? So they're taking information that maybe doesn't even necessarily apply to the park itself, but it's more about they're looking at travel schedules, airplane, hurricane, viral forecasts. So looking at flu seasons and things like that, because that all kind of impacts. They've done enough historical data and combing of that that they know what level of impact that has on people who are coming to Disney World to visit. So it's very integrated. And then they think, okay, then they start to drive people like based on kind of how they're starting to show up in different rides. And then they start to elevate different rides. So, like, if there's a really long line at one of the rides, then they just start to create fast passes or go to this ride or things like that. So they almost kind of organically start to manage that. That's where I think healthcare has an opportunity. There's seasonal and historical patterns to all of this. There's leading and lagging indicators, but again, it's so much data that's so overwhelming from a healthcare standpoint that that we're just living in the reactive instead of the proactive. So, you know what? I think the hospital or the health system of the future is kind of taking in all of that information, whether it's like long-term information, what's the community housing and like what's the population growth or shrinkage, what's the demographics and what does that mean, if we have a shifting community that's aging, they're in 55 or 60, but they're reasonably economically viable, then we know we might have more pickleball injuries or things like that. So how are we using information outside of healthcare to help us drive resources so that the healthcare system is ready when it needs, when our community needs us?
Absolutely. And in terms of more specific guidance for startups, what area of the hospital should they focus on in terms of innovation?
Other than wellness and specifically, I think just continuing to focus on work streams. So we're very complicated. We need a lot of data. We have so much data that it's almost overwhelming. So as they can start to find things that can help us with clinical decision making tools, reducing a lot of the rote tasks that we have in day to day that can free up that time for us to be able to give that back to our patients. I think that that's probably very helpful. Even like from a finance standpoint, there are so many things that, just going through all of that stuff, there's a lot of things that AI can really kind of help us take some of that workload off of us now, start thinking disruptive, but then bigger picture. How do we start thinking more systematically integrated within the community?
Especially as we're about to get a lot more data than we could have
Right.
ever imagined. And so that's really, really sound advice because we're going to need some ways to interpret and deploy that data instead of just kind of sitting on it. All right. Last
Yeah.
question, Misty. What keeps you up at night from an AI standpoint, not just AI for good, but just from an AI standpoint, what keeps you up at night?
I think it's the ethics and morality, just making sure that we're not so excited about the technology that we're not doing a thorough job in investing or vetting it. And what I mean by that is, we've got a lot of healthcare data, but some of that is particularly limited. So, like for example, there was up until the 60s or 70s, there wasn't a requirement to include women in research because we're biologically different than men. So a lot of our evidence is based off of very narrow, specific patient populations that don't necessarily translate to all patient populations. So if we're not careful about the data that we're feeding the models that it learns, we could end up with models that are or recommendations that are coming from a very unintentional but a very biased standard, and that could take us down again from a patient safety standpoint. That could get us to clinical decision making that is not appropriate at all for people of color, for women, for you name it. Even so we just have to be really cautious to make sure that we're not that technology is still continuing to keep healthcare inclusive and that we're not unintentionally excluding people from and making sure that we're not keeping them from getting their equitable care.
And that's happening already. There's
Mhm.
been a lot of quote unquote whistleblowers that have come out and said that, there are deep biases in the models that are being addressed, but the biases are there. And now the
Yep.
question is, how do we remedy that? How do we modify for that? And how do we almost prevent that going forward? And I think that's where having these councils that are cross borders, cross platform, cross company, coming
Mhm.
together, mutually agreeing, we're all going to do this because I think the challenge we face with AI is it doesn't exist in a silo. You can't say this is
Right.
my AI and that hospital has their AI and Kaiser has their. It's eventually going to have to be, that we're using the standardized AI model just because how fast it's learning and growing,
Exactly.
it's gonna eventually converge. And my concern is that we're not looking far enough into what that convergence looks like. And we need to pull those conversations now such that we're not, 5 years, 6 years down the road having to trash and restart because we didn't think this
Right.
through in terms of what needed to be done. So, and what are you most excited about? I know you've shared so much already, but just final one line, what brings a smile to your face when you think of AI?
I think the impact on the clinician wellness right now is really what gives me heart. So, you talked about that, getting evenings back and reducing pillow time for physicians, nurses being able to focus less on, oh, I've got to get this, and this documented and be able to focus more on patients and the relationship development. So I think that, that is really going to give us time back to be the clinicians that we wanted to be. And I think that that's really important when we're thinking of professional practice. So to me, it's almost like a thank you because now I can focus on the things that I'm really passionate about because I can have that relationship and that connection with patients. And I don't have to spend all of my time documenting the care from a compliance or legal protection standpoint and things like that. So I'm really excited about some of that. Just getting us back to professional practice of what we idealized when we started our training.
And I'm deeply excited, Misty, to have someone like you, someone with deep thoughtfulness, awareness of AI in terms of how you're going to roll this out because being at Stanford, everyone's going to be watching you in terms of how things are being rolled out. What are the impacts? What are the case studies? You're going to be at the forefront of bringing AI into healthcare, and I'm just so grateful that it's someone like you with deep integrity and ethics and morality, and really, a focus on patient care and doctor care. So thank you so much again, Misty, for joining us today. For the rest of you, keep tuning in to WAIFO, keep tuning in and thinking about what does AI for good mean for humanity because this time will not come back. We all need to be thinking of how do we make sure that AI serves humanity to be its highest embodiment versus enslaving humanity because we're seeing both sides of the picture right now.
That's right.
Thank you for
That's right.
tuning in. Misty, thank you so much again for your time. Really appreciate it.
My pleasure, Rena. Thank you so much.